Thanks, Deb. She's given me to you, which is a really interesting concept. Before I start, I'd like to invite the first panel on stage. And we have one virtual panelist who I will introduce in a few seconds. And then I'm just going to say a few remarks to set the context for the day. Just listening to the inspirational talks that just happened from Victor and Vivek and Deb really inspires me. It's just, I'm a big fan of Peter Gabriel. Do you know who Peter Gabriel is, the singer? Peter Gabriel has a great song about the anti-apartheid activist Biko. And one of the lines is, you can blow out a candle, but you can't blow out a fire. Once the flames begin to catch, the wind just blows it higher. So one of the themes that we're working on today, as you heard in all three of those talks, was that we may be a candle that lights up a little bit of the darkness if we're just individuals, but together we can make a huge change. So this is one of the more important things, I think, in this young year that all of us could have been involved in. Because we're gathered here not just to reflect on what we've done, but to celebrate. Today is a day dedicated to recognizing the incredible progress that's been made together over the last year. It's a moment to pause, to appreciate what has been accomplished, and most importantly, to look ahead with purpose, mission, and inspiration. 1 year ago, almost to the day, the NAM Collaborative laid out a bold vision for our national plan for health workforce well-being. A vision for what can happen when we come together with a shared commitment to support the incredible people who make our healthcare system work, who take care of our children, our loved ones, ourselves, our neighbors, etc. This is a plan rooted in collective action, as I just said, recognizing that we all, from local governments to health systems, to insurers, to IT companies, professional societies, to health organizations, and to you, everybody who's here in this auditorium and everybody who's looking at this virtually. The 7 priority areas that Dr. Zhao talked about, outlined in this plan, are not just a set of ideas. They are calls to action. They represent the areas where we can make the most significant, the most immediate impact in catalyzing change and improving the well-being of our healthcare workforce. But change doesn't happen in isolation. It requires coordination, collaboration, commitment, and we think a systems-based approach. Today, we have a unique opportunity to remind ourselves of that and to amplify those efforts. You'll hear from some incredible people, this panel being one of the representatives of them, in the field who are already doing the hard work to advance some of these priorities. They will share their journeys, challenges, and victories, and how their work is shaping the health future of our healthcare workforce. Beyond the specific examples you'll hear about in a few minutes and for the rest of the day, I want to emphasize that advancing all of the 7 priorities is essential to creating lasting change. The momentum we build must move in all directions. That's the only way we will build a workforce that is resilient, well-supported, and prepared to care for the people who need the care the most. And those are the people who you are connected with, and you actually sitting in the audience and on this virtual meeting. Within the NAM Collaborative, we are incredibly proud of the 23 Change Maker Accelerators. Are there examples of those people in here? Could you just stand up if you're one of the accelerators? And give a round of applause to what their accomplishment. This dedicated group of leaders is directly tracking the progress of well-being initiatives at their own institutions. Through their experience, we are learning vital lessons that will help pave the way for a broader, system-wide progress across all 7 priority areas. These accelerators are truly leading the charge, and the stories they have to share are inspiring. Before we dive into the panel, let me give a couple of highlights in 3 of the priority areas that have already been accomplished. In priority area 1, creating and sustaining positive work and learning environments, we have 117 different initiatives across accelerator organizations driving culture change, integrating well-being at the heart of their organizational operations. This is the foundation of everything that we're doing. In priority 2, investing in measurement, assessment, strategies, and research, we've been documenting the tools and strategies that are working, identifying barriers, and finding ways to use data to drive change. We are no longer just reacting to stressors, we are taking proactive action to deal with them. And in priority area number 4, addressing compliance, regulatory, and policy barriers, where there's work being done to simplify documentation, reduce administrative burdens to allow a more meaningful time spent with patients and focusing on personal well-being. This also is a critical priority as we move forward. Those are just a few of the examples of the work underway. There is so much more that I encourage you not to lose sight of, because together, can I say it one more time? Together, we're making a difference. I encourage you to stay engaged throughout the day, especially during the Changemaker Summit. This comes this afternoon at 1:30, where we'll dive deeper into those priorities. But now it's time for me to introduce our exceptional panelists who are at the forefront of this work. Please join me in welcoming Corey Feist, who is the founder and CEO of the Dr. Lorna Breen Heroes Foundation. Give him a round of applause. You can wave, Corey, where you are. Jennifer Bickel, who is the inaugural Vice President and Chief Wellness Officer, University of Texas MD Anderson Cancer Center. Jennifer, wave. Carlton Abner, the Associate Provost for Campus Health and Wellness at Kansas City University. Raise your hand. And online, we have Gregory Adder, who is the Chief Medical Information Officer Emeritus at the University of Kansas Health System. I don't know if we can show him and wave his hand, but is he there? There he is. There he is. Each of them will take us through an area of impact. Corey will kick off by discussing the work in priority area number 3, focusing on mental health and reducing stigma. Gregory Adder will then explore priority area number 5, sharing how we can leverage technology tools to drive well-being. Jennifer will dive into priority area number 6, focusing on how we can institutionalize well-being as a long-term value and commitment in our organizations. And Carlton will round out the discussion by sharing his approach to priority number 7, which focuses on recruiting and retaining our healthcare workforce. After each one shares their insights, I'm going to tell them what the final question is going to be. I don't know if you knew this, but I'm going to tell it to you so you can start thinking about it. The final questions is not just what you are doing, what you have done and what you are doing, but what are you going to do to sustain the efforts in your area? What are you going to do to sustain it? Because that's the important thing that we need to do. We need to move forward. The work today isn't about what's happening now. It's about building a foundation that will carry us forward for years to come. The momentum we build here in this room and beyond will continue to grow, expand, and transform our healthcare workforce for the better. So let's get started. I'm incredibly excited to hear from our panelists and to continue this journey together. Thank you all for being here, whether you're in person or whether you're online. So let's go to our panelists. As I'm coming into landing and to sit down, Corey, please kick us off with your insights into the work you're doing to advance priority number 3, supporting mental health and reducing stigma. Thank you.
Thanks, Tim. Did you have a clicker for me, or am I just asking to advance?
I have a clicker for you. Do I have a clicker for you, Corey?
I
have a clicker for you.
It's all about the clicker. It's all about the clicker. All right. There's a big green button that says click here. Yeah. Perfect. Rule following. My team will say he's not very good at that. It's great to be with you all today. I'm here to provide an update on really significant progress that we've had in addressing the mental health challenges of healthcare professionals, and specifically eliminating and reducing the barriers to help seeking. I'm here on behalf of the Dr. Lorna Breen Heroes Foundation, as well as our All-In Wellbeing First for Healthcare National Collaborative, which now has over 30 national organizations spanning pharmacy and hospitals and physicians, and our friends at CHARM, which John came up with that acronym, and I'm not still sure. It's a great collaborative of all of our chief wellbeing officers, And. We've got a wonderful group of people who are all locking arms around the mental health and well-being of health workers. For our all-in Well-Being First coalition, we focus in two areas. First, in removing these mental health barriers, as well as scaling well-being solutions, heavily focused on a lot of the operational things that you heard Dr. Murthy and others speak about today. I'm going to speak with you specifically on this mental health topic, but I've just wanted to orient you to the work very briefly of the Lorna Breen Foundation, which is focusing not just on accelerating solutions, but also advocacy at the federal and state level and advancing collaboration like we're doing through our all-in work. You have seen, if you have the handouts, you've seen there are a number of recognition programs that are listed in one of the documents, and one of those is our All-In Champions Challenge for both licensing and credentialing. And in that Champions Challenge, what we do is we challenge organizations to take 3 steps to first audit the questions that they may be asking applicants, change the questions to best practice and really alignment with the Americans with Disabilities Act. And then the third and frankly most important of all is to communicate, can I say it again, Tim? Communicate what the new rules are to health workers, because we continue to hear over and over again about this institutionalized stigma around help seeking. So just to give you a sense about our national leaders who tend to agree with us, you will recognize almost all of those logos if you don't already. These are all national organizations who have said, yes, we need to jump on board. Everybody in the country needs to jump on board with this Champions Challenge. For those of you who may be interested in joining the Champions Challenge, this is no cost to you, your organization, a little sweat equity, maybe a little political capital if needed, but really what we're asking you to do is just use that QR code and then be recognized by our organization. I should say that when you apply to be recognized, we work with you. We have a set of volunteer lawyers, including lawyers at the American Medical Association, that help to review these and bring you into compliance, if you will, with best practices. For the first year in the challenge, we give you the badge for making the changes. For subsequent years, because we know communication is so important, we give you another badge for demonstrating to us 3 examples of how you've communicated your badge to the workforce, because nothing happens different unless the workforce knows the rules. But as you can see from this slide, in just a few years doing this work, we have now badged organizations representing over 1.25 million health workers in the United States, which is, for the little engine that could, the Lorna Breen Foundation and our All-In Coalition, really good progress in just a very short period of time. So I want to thank everybody in this room and online who may already receive the badge. And one of our calls to action for this National Health Worker Wellbeing Day is to make sure you take time to just communicate what the badge means to your workers. This map, and when you go on our website, you can see this source of truth for health workers. You'll see a map that's got bright blue on it. The bright blue states are states who have hospitals which have received our badge. And when you click on each of those bright blue states, what you'll see is a whole list of the hospitals who we've awarded badges to. This slide says over 520. The reality as I sit here today is we are now at over 10% of the hospitals in the United States, about 650 hospitals we've recognized. That was from a baseline of 0, just about 2-3 years ago. On medical licensing, we started with 17 purple states. We are now over 34 purple states. Again, benefiting thousands and thousands of physicians in the United States. We are continuing to make progress on nursing, on dental, and on pharmacy. And these are all, again, to me, examples that progress isn't just possible, but it is absolutely within reach on the mental health side. So tomorrow, we are launching a new national campaign. And I need to just take a moment to celebrate our Chief Medical Officer, Dr. Stephanie Simmons, who's here with her lovely daughter, Vivian, today. Dr. Simmons worked tirelessly with our All-In Coalition over a year to come together in alignment on 6 discrete actions for organizations to take to demonstrate that they are all in for the mental health of health workers. And we believe in this campaign that not just, where patients have the right to mental health access, health workers have the right too. They simply do. And it's incumbent on all of us to lock arms and just make sure that those rights that they have are accessible, and they can get the care that they need. And so in order to demonstrate that you're all in for the mental health of health workers, we are encouraging organizations, policymakers, and individuals to look at these 6 icons of action. You know, we don't do anything without action at the Lorna Breen Foundation and our All In Coalition. We believe to be all in for mental health, there needs to be accessible and affordable mental health care for health workers. We need confidential professional health programs. We need equal privacy for the mental health. Now, that equal privacy box is all about our Champions Challenge. We also know about confidential peer support. We must have that be confidential, particularly when you realize that we're asking peers to fill out reference forms for credentialing and re-credentialing of hospital workers. That peer reference and that peer support has to be confidential. We also know that education and training is critical to this endeavor. Training on suicide prevention and other different mental health conditions really has a way to accelerate positively the culture as well as the access to mental health care. And then finally, for clinicians, particularly those who have been in formal treatment, providing supportive pathways for reentry are absolutely critical so that those individuals can get back to work, doing the great jobs that they know they can do, taking care of patients. So as we roll this out tomorrow, you all are getting a preview of this that we're rolling out tomorrow at 9 a.m. We're asking organizations to learn about these 6 areas, to act on them, particularly when we're talking about discrete actions to eliminate barriers to mental health access, and then communicate. Can I say it again? Communicate. So tomorrow we are launching this website, allinformentalhealth.org. We believe that a stronger system is definitely within reach, and I'm really excited to be able to share this with you just a little bit early with this audience today. Tim, thank you.
Thank you. Give a round of applause to Corey, please, for that really inspiring talk. Greg will now come on and talk to us about priority area number 5, how to engage effective technology tools. Greg, you're on.
All right. Can you hear me okay?
Yes.
Good?
Yes.
All right. Thank you. Well, sorry I couldn't join you in person today, but I'm really encouraged by what I have to report today regarding technology. I appreciate the leadership of the ACGME and the others on this call, particularly regarding workforce and the young folks, particularly increasingly that need, I think, help from their institution to make sure that technology works for them. And so appreciate that support. What I'm going to talk about today is something that I think is kind of course, taken the world by storm, and that is the AI, and I'm particularly going to focus on its impact on documentation. So as a CMIO, this is a bright spot. Some of the things that I brought to our teammates on the front lines involve a lot of clicks and complexity and frustration, and frequently there's a paucity of a tangible benefit to the person doing the clicking. So today, though, the good news of really AI in the exam room, I think, is really an unvarnished positive. Of course, there are exceptions to what I have to say today, but I think if organizations will really consider that it's important to have folks like me who help the technology experts in the IT department really bring it home as far as something that works for doctors. As I say, this has let me back in the lunchroom. Quite frankly, sometimes it's hard for me to go down and sit with my colleagues to talk about the challenges of patient care, teaching, and collaborating on solutions when the latest upgrade is seen as more of a downgrade. But anyway, what I want to do, and it's really been facilitating that, is to get them home for dinner, to get them back to their families to do what they want to do besides playing with the computer and working on their typing skills. So at KU right now, we're a large academic medical center, and The technology, I'd just like to define it for this particular area that I'm highlighting, and that is we're talking about ambient AI. And it's basically an app that you enter the room, typically have a short conversation with the patients about technology. Everyone, when I say, this is going to help me talk to you instead of talking to the computer, they just light up and get excited. It's really amazing. But it's not intrusive. It really does allow that focus on what you're about, and the cognitive dissonance that comes from having to do multiple things at once, including concerns about the next patient who's out in the waiting room, working on their satisfaction survey, and tapping their toe, this just really allows the whole thing to go better. I think one of the other benefits is the potential to have billing be a side effect of a byproduct, if you will, of the care instead of another focus and more clicks. And so the ability to do real-time coding right when it's fresh is an incredible stress reliever for providers, because we do need to generate bills, no margin, no mission, as they say. But let's see if we can reduce some of the challenges to doing that. I think one of the things I want to highlight in just a moment is that it actually worked. And is it magic? No. Is it perfect? No. But it actually is a giant step in the right direction as far as really helping providers, again, do one of those things that I've heard 1,000 times over my many years. I didn't go to medical school to learn how to type. And, that's exactly right. They didn't. This just really, really helps with that. So back to the tie to education and workforce, I'm going to report on a little work that two of our fellows, we host a clinical informatics training program, which has just been an incredible opportunity. And we have many of these around the country. We have two fellows and another one starting in July. And the current fellows worked on two projects, one on cognitive load and trying to appreciate really how that impacts the work in the exam room. We used a modified NASA TLX instrument, and we're able to demonstrate for 40 users that there was a 60% reduction in cognitive load with this approach. It was hard to do our study because we had a hard time getting people to not use it and to go back to the old way of doing things. So we did another study on perceptions of AI in the exam room, and with 100 participants, we found a very significant decrease in the burden of documentation, the ability to complete your notes, and less time spent outside of the clinic session doing documentation. So what that leads to really is, as with cognitive load reduction, is a lower risk of burnout and increased job satisfaction. So that's really been amazing. So as I'm talking a lot about how the note is created, there are a lot of things coming down the pike. Many of the vendors in this space, we work with Abridge, and I've had a very good experience with them. But chart summarization, the most time is spent actually in generating notes, but right behind that is digging around in the chart, looking for what it is I need to do for this patient today. What's their care journey? So chart summarization, in basket, dramatic increase in messages after COVID. So how do we get through those repetitive ones that are typically heard hundreds of times over a week? Ordering process, and then also clinical decision support. So a lot of these are fairly scary as you get into how the IT and the AI interact, but a lot of these are very basic, and the risk, the issues with bias and all of the concerns really are pretty straightforward, but we do need to be concerned as we get into these higher level aspects of using technology. So I just want to close. I think this is about bringing joy back into medicine. And again, I've been involved with a number of initiatives, and I really think that the workforce, I think the training, getting the word out on how IT and clinical care don't have to be at odds and how they can complement one another to the benefit of the patients, and making doctors better doctors instead of better typists. Again, with that, I just appreciate this opportunity to present some of our work, and it's an exciting time really for clinicians. Thank you very much.
Okay, let's give a round of applause to Greg for that wonderful message. Next, I'd like to turn the microphone over to Jen, who will talk about priority area number 6, institutionalizing well-being as a long-term value. Jen?
Absolutely. Thank you, Tim. So, I think we're at a time in life in healthcare in which, everybody agrees that well-being matters, but how do you make it a value? How do you actually prioritize things, right? And prioritization means that we put leadership around it, we commit to it, we look at it through our processes, we look at it through our outcomes. We don't just give high fives in the hallway and say we care about it, right? And this is hard. I mean, this is really hard work because our healthcare systems, quite frankly, were built without well-being being one of the top priorities. So we're trying to almost retrofit what the healthcare systems is. Right. I mean, I even think, Corey, as you're talking about the credentialing, right? What got us into that problem in the first place? So first of all, my gratitude to all of you guys that are here, right? My gratitude for all of you who have taken a part of your career and dedicated it and made well-being a value for your career and influencing those around you. I had the pleasure of joining MD Anderson as their Chief Wellness Officer a few months ago. And so I'm up here talking and taking credit for work that was started before me. But I think that this is about what institutionalizing well-being means. That because of the National Academy of Medicine framework, I was able to join an organization in which I didn't have to tell leaders what wellness was. Imagine that gift, guys. Right? That I was able to talk to leaders who already understood that this went beyond personal responsibilities, beyond personal grit, though of course resilience matters, but instead went to how do we run the organization. So even Dr. Pisters, our president, spent the majority of the time talking to me, telling me why well-being matters, telling me why mental health is so important, and talking to me about the statistics of the amount of employees that we have that might be suffering from anxiety or depression and why we have to do something about it. And so when I think about institutionalizing well-being as a value, that's really what I see, is I see that when executives are able to tell people why it matters, not why wellness leaders are telling executives why it matters, right? We've also seen a lot of work in a lot of different areas, including credentialing, right? But also the formation of an ease of practice committee, a committee of VPs and other leaders, including informatics, but also quality leaders and process leaders, looking at how do we change processes in order to get people doing the work that they want to do? How do we remove frustrations of those days? We have wellness leaders in the various divisions that receive reimbursement for their work, and also who have been able to go through the training programs that have been offered by Stanford and others. And one of the reasons why I want to emphasize the National Academy of Medicine sort of framework and prioritization of it is that it gives me the ability that when I talk with leaders in different areas, I can point out what part of it they can influence, right? What part of it they can own, what part of it they can do. Now, part of that might be selfish because I don't want the responsibilities as Chief Wellness Officer for all 27,000 people's wellness all on my own, right? But I really want people to understand that this is a collaborative. The other thing that I'll say is, I always think about this work in the framework of like the safety movement, right? And if we think about how all of our organizations prioritize safety, I think all of us have safety leaders in the organizations. We have safety leaders representative, we have outcomes, we have board metrics, all of those related to safety. And because safety is a value, right? That is a prioritization. And I think that if we expected to make any changes in safety by appointing one person and giving them a 0.5 and then putting them in the basement and saying, go team, we would never make a difference, right? And we cannot do that with wellness. We cannot do that with wellness. We have to use those same sort of metrics because that's what prioritization is doing, and that's how we move the needle. And so we are at, I don't want to keep saying that we're at the beginning because clearly so much has happened. But this is a huge movement, right? This is a huge movement. And I'll tell you guys this that I think about sometimes is your remember when stories, right? And so like Corey, listening to you talk, remember when there were no boards that had this, right? Remember when only a few states were doing this. What are your remember when stories about that you can share over a few years ago, even about how things used to be? And in 10 years, I think we're going to be able to show even more movements in that direction. And I'll just give one example of that, just a tiny example. As one of our division leads in wellness had written a book chapter about 10 years ago about wellness in pediatric oncology. And she went to do the edition update, as all of us in academics do, and you go there and you're like, oh, I'll just do a little bit of minor changes here, no big deal. And she went and looked at it and realized the entire chapter, even the headings, had to be rewritten because the amount of evidence and the amount of new information that has come out over the past 10 years really meant that the entire chapter had to be transformed. That is huge, guys, right? That is really huge, and that's where we're heading. And I think that there's no doubt that there's challenges ahead. There's no doubt there's ongoing challenges. But as we maintain our commitment to well-being, we have the opportunity to use these challenges to transform us to any even better outcomes.
And to round out this inspirational panel, I'm going to turn it over to Carlton, who is the only one he wanted you all to know that dressed for St. Patrick's Day today of us. And he's going to share his approach to priority area number 7, recruiting and retaining our health workforce. So, Carlton, you're right.
Corey leans over, as Corey does, and says, no pressure. I'm honestly glad that the order went like this. It's quite divine, because, Jen, I'm going to piggyback off of what you said. It'll dovetail really nicely. Because sure, there are some tactics and best practices and the progress that we have made at Kansas University when it comes to recruiting and retention. But I want to first start with a story that deals a lot with leadership. And it's from, I just recently retired from the military about a year and a half ago. And I'm often reminded of where and when that journey started. And it was 1992 at Fort Leonard Wood, Missouri. And I was doing basic training. And I was 17 years old. And even though I was that young, this particular experience is probably one of the most impactful leadership experiences I've ever had to this day, 33 years later. And it is a story of a tale of two platoons. I'm in first platoon, and then there's second platoon. And if you've ever seen units marching, there's usually a flag that they have. It's called the guidon. And the guidon basically announces, who's coming behind that person. Nomenclature on the flag that says who these people are. And then in basic training, there's always competition. Which one is the best platoon? And so if you've got, the platoon that did the best at the range, or the platoon that achieved the best physical fitness scores, or tested the best in whatever block we were testing on, you would get a streamer denoting such, and that would be added to your guidon. And so the difference is second platoon was winning everything. Everything. Like, they had so many streamers from their guidon, you could barely see the flag. Like, it looked like a mop. It was just covered in streamers. And we had a couple, but it wasn't a lot. And maybe the reason why this is such a memorable moment for me is because I was the guidon bearer for first platoon. Quite the distinction. First element of the first company in our battalion. So I'm carrying the guidon, Delta 3-5, or Bravo company, first platoon. I'm carrying that guidon with our 1 or 2 streamers, and I know behind us is this representation of excellence that we had not yet achieved. And At 17, I guess I'm just budding researcher. I'm an observer, an astute observer of what is causing that. Why the difference? And a difference to start, but why? And I began to see this reoccurring pattern along the lines of leadership. And listen, no one's making friends with your drill sergeant at basic training, right? Like, so there's always this point where a drill sergeant sees a departure from the standard or something that you could have done better, and the entry point is always the same. They're going to point it out, and with some very colorful language, probably the most colorful language I had heard up to that point in my life, but they're going to point it out, and that was happening in 1st Platoon. But the intervention is where the divergence occurs. So our leadership would point out the infraction and then say, you should have known better. 2nd Platoon's leadership would point out the infraction and say, here's the standard. Here's where you are. Here's the gap between those two. And here's what I think you can do to improve that gap. The entry point, exact same. But the intervention was the difference. And so we're given 5 minutes here to kind of talk about what it is we're doing and why waste most of my time on that story. It is because when it comes to recruiting and retention, I've already shared with you what the difference is. I could have talked about 1 or 2 best practices or 1 or 2 interventions that you could have done or you can do and you can take back to you. But if you're not thinking about then what, I'm not sure that you'll get the most out of those interventions. And I'm here to tell you that at Kansas City University, we've got that 2nd Platoon type leadership. Dr. Mark Hahn, who is leading us, I'm a tangible representation of the investment that we have in our students' experience. And that's what I'm talking about. The then what is, what's the experience when they get there? At Kansas City University, day 1, year 1, when our students show up, we talk to them about coping. We talk to them about resilience. We talk to them about a lot of the stuff that's maybe not related specifically to their academics, but it has a lot to do with how they're going to perform academically. And the literature is pretty clear that this particular generation, Gen Z, who are, let's say, in the range of 15 to 30 years old, there's some opportunity there to help them with their coping and their resilience and how they handle adversity. So that's definitely one of the things. We grab them day 1, year 1, and say, hey, this stuff matters. You matter. The experience you're having here matters. Your academics absolutely matter. But, we can kind of balance those. We can hold those in pretty near equal measure. And that's one of the things that's happening at Kansas City University, because if you, the leader, whatever level you're at, if you don't have, like an awareness of, hey, man, I wonder what it's like for my team members when they get into the car and drive to work. And if all you're focused on is their performance when they get there, I'm not sure the tactics in your recruiting and your retention are going to have the impact that you hope. Because here's the thing, if you don't think performance is a leadership issue, I'm not sure leadership is for you. So you have to have an awareness of the experience. Are there tactics? Are there things that you can do? Absolutely, we're doing them. And I promise you that when it comes to supplying you with the human resources you need, the clinicians you need at your facilities, we're doing everything we can to make sure you have people who are prepared to answer the calls that your communities and missions have driven you to do. We're working hard to give you the best of the best. But then what? And that is one thing that as you look at the tactics and look at the best practices of what you're doing for recruiting and retention, that I hope you spend some time on, that experience piece. And like I said, we're doing everything I can to make sure that we're helping you with that. Tim?
Thanks, Carl. Give him a round of applause, please. I'm going to turn to my boss, An, or whoever else is on here. We've gone a little bit over on the panel. Do we still have the time to do the? Okay. So here's the challenge, panel. And I'm looking at you too, Greg. You can't see me. We have 20 minutes. We can do this in a row, boom, 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 or there can be some discussion between you. In 20 minutes, what we need to know is, what are you doing not only to sustain the momentum for your work, But as you just said, Carlton, what do we need to do to sustain the momentum for our work? So anybody who would like to start, and if I'm going to give you like 15 seconds, Carlton's going to start.
I saw Corey chomping at the bit, so I just wanted to make sure that I'm going where Jen landed, or kind of included, like safety, quality control, metrics, doctrine, structure. The then what for us? What are we doing to make sure we sustain this? Is Kansas City University will continue to invest in our students' experience, but now we're making this turn. My job is to show Kansas City University and the world what you get out of that investment. And so the data also has to be there. This is what we're doing. This is what it's causing. I don't have streamers. We're not carrying guidons, right? But I can put numbers and values to what we're getting out of that investment. And I think for me, it's the preeminent focus for sustainment on our end.
All right, since he called me out, I don't know what that face was that you saw because you're looking at the back of my head, but that's okay. So I think we have to start at the top of organizations and think, what do boards of directors need to currently know and what do they need to know? I think that our survey at the Lorna Breen Foundation shows that boards of directors know very little about this issue, and they are the ones who hold leaders and organizations actually accountable. And so I think that we have to start in institutions at the board level. And then I think it's right where Jen went, which is at the leadership level, how do we ingrain this operationally? And we need to be developing those KPIs that move the needle, right? Those KPIs of that are not just the lagging indicators of turnover, but also what are those either leading or real-time indicators. And I would also just say healthcare is so siloed. I think one of the beauties of this room today, one of the beauties of our All In Coalition is that we do this work in an interdisciplinary fashion. This is not just one group. And I would say we need to recognize that leaders in the United States are all feeling those pressures that the clinicians are feeling. And so we can't just say, oh, this is only a clinician problem. This is everyone's problem. And so if we start at the board level and then we work our way down, I think that's how this continues to get ingrained. And as I said, I think what we continue to hear is boards in particular are not involved. And even as Jen was saying, I think leaders are at different parts of their journey. I had the benefit of teaching a class on this subject to a business school last night, or yesterday afternoon, I guess. And one of the students who actually comes from the insurance industry said, I assume good intent on this, that leaders want to help, but do not assume that they know what to do. And I think that's the next level of it, right? Is for all people, whether you're on a board, whether you're at a C-suite, whether you're a frontline leader, what is that thing that you can do to demonstrably move the needle? And again, doing this in an interdisciplinary way. The last comment I would make is something that I think is, we don't talk about this at all, but this is an observation I would make. When right now most people hear the word well-being, the default is kitty cat posters and meditation apps. And so when we have to go into that C-suite and make that request, I think we have to recognize that when we go in and we say, I'm talking about well-being programming, Jen, they're going to be saying, the default in the mind is going to be, oh boy, here we go. Well, I have an employee assistance program and I've got the apps and I've got all that. What we're actually talking about, what I've heard today, is hardcore leadership, hardcore operations. This is the redesign, as you were saying. And it's not a soft science. And so that recognition that this word, what does this word mean? Do we need another word? We'll have to rebrand everything, but that's okay. It's more opportunities for communications marketing firm. But what do we mean by this word, and how do we overcome that, I'll say stigma, that, oh, this is just this is HR's problem, or this is, I'm just going to delegate this over there. This is talking about the day-to-day operations. So those are just some of my top-line thoughts on how do we make this a sustainable thing for healthcare, I think Tate Shanafels calls it well-being 2.0 or 3.0. I can't remember what 0.0 we're up, but this is the next iteration. We cannot innovate in healthcare. We can't do any of those IT solutions unless the workforce is thriving. Innovation begins at the workforce level, and that's just key to the operations and leadership. So, thanks.
But Carlton has just really jumped towards this microphone, so Jen, can you just pause for a second? Go for it.
Just 1 minute. I wanted to 100% agree with you. It is the response I get a lot, particularly from some of our faculty members. And my operational objective has always been capacity. Capacity. How do I protect? Because the medical school, and even healthcare delivery, there's not going to be kitty cat posters and happiness all the time, right? But what are you doing to protect capacity? And I try to front load that message so people don't hear, oh, you just want them to be happy. No, I want to protect their capacity. I want you to be aware of what you're doing that might be drawing unnecessarily from that capacity. So I 100% agree with you. Not saying that's the answer, but saying, yeah, definitely want to find an operational way of framing this for some of our leaders.
You can turn it over to Jen. Oh, go ahead, Greg.
Yeah, can I, actually, Carlton, I don't know whether you're aware that we're working with Dr. White at your institution, just to this very thing. I think once you get a workforce, I would like to talk about development of that workforce, and really, because technology is, it's way beyond IT now. That was kind of the days of the referential system where, Dr. Ader, tell me what that potassium was last night. We're way beyond that. So once you get a good workforce, getting them from early on to understand how technology and healthcare go together, and actually can go together in a very nice way instead of clicks and pain. And so I really think it's important to try to think about how do we start early, and the KCU, KU thing that I talked about is actually starting at the undergraduate level, working with medical students and residents, fellows, and other disciplines, and help them understand that they can have a way to really use their technical interests and aptitudes to actually help doctors take better care of patients. So I think it's sometimes in organizations, the thought is, well, we pay doctors to do heart failure medicine with the nursing workforce. Well, actually, the informatics things that I'm talking about are not something that people learned in medical school. And unless they're a computer science engineer, they didn't learn it in their undergraduate preparation. So there's really a body of information of informatics. That is, how do you marry IT and clinical practice for happiness? I'll just kind of distill it. Is not something that people are born with. And there's, in fact, a medical specialty now, a board certification that is required. And so getting people young and early to sort of nurture these interests in technology and help them apply it in the day-to-day. I think the more informaticians and board certified folks you have at your organization, I think you're going to have a measurable improvement in the experience with technology of the day-to-day worker. So I just want to put a plug in for that.
Thanks, that's great. Jen, you want to say some words on this?
Yeah, absolutely. So a couple things is a confession that I'm one of those people that used to roll my eyes at wellness all the time, right? Like the connotation, right? I never imagined that I would have changed my career to this, but really for me, seen as an existential threat to healthcare delivery, right? I believe in healers. I believe in our passion. That's actually what got me into it. Was not a passion for wellness per se, but a passion for healthcare delivery. But a couple things about sustainability. Two key points that I want to make up is one is a reminder that no human being controls anyone else's well-being, right? We don't control the well-being of our spouse. We don't control the well-being of our children as much as we would like to. And we don't control the well-being of our organizations, right, or of individuals. However, we can create opportunities for well-being, right? We can create it where it's more likely to occur. And the reason I bring this up with sustainability is that sometimes it can be hard to witness suffering, and you wonder, am I making a difference? Is what I'm doing making a difference? And reminding that our work is to create environments in which well-being is more likely to occur, but we can't always control if the well-being occurs or not. And second, sustainability. This is, I have the pleasure of working with well-being leaders across the country in so many different ways. And I absolutely agree that sustainability starts with the board, but it also starts with ourselves, right? Anybody feeling a little overwhelmed these days? Right? Anybody wondering about what sort of impact you're going to make, right? And I think that really practicing some of the different things that we preach is going to be crucial, right? How do we practice positive reflection, right? How do we look for the wins? How do we look for what we're doing? And how do we maintain our hope and our path forward? And I think about this, and one of the things that I say all the time is inaction is not an option. This work is way too important, right? And so how do we sustain ourselves through this work as we move forward?
That's great. There's a follow-up question I have for all of you then. If this was church right now, there would be two places where this audience I heard would say amen, right? One was when you talked about the crucial role of leadership, and the second one was what Jen just said about yourselves. One of the issues that I keep talking to when I talk to people out there that they seem to need is not the need of the leaders to do what, but how does somebody in the clinical well-being office approach a leader so that they can begin to make an alliance to make change? And then second would be, how do you sustain yourselves as you go through this, where, my favorite Japanese expression is fall down 7 times, stand up 8. Okay, so we have actually 9 minutes left, so roughly 2 minutes.
I'll lead it off again because it just happened to me. And my leader, my president, is online watching right now, so I don't mind sharing this with you. I would do this anyway. The connection, right? Yeah, your leaders need the connection. Fortunately for me, visionary is the word that I would use to describe. I mentioned I retired from the military 24 years. I say that as a preface to this next statement. Kansas City University is the most mission-aligned organization I've ever been a part of, ever. And that's qualifying that statement with 24 years of military service. And that's because that's the kind of leadership we have. Everyone knows what our mission is, and they try to live that in some way. There are barriers, there are opportunities, there are obstacles. The connection I made was just when I saw the good leadership, that second platoon leadership I talked about, I made it a point to tell them, hey, we had a town hall recently. What you said, spot on. We know that there are stressors out there that are impacting the faculty, the students, and this was just all employees, right? Saw it, made it a point to say, that was it. More of that. Keep doing that. Keep doing that. And it felt well received in the moment. And he has a military background too, so we were able to connect on leadership. For me, practicing what I preach, yeah, that's hard. But I have been in President's cabinet and said, hey, like last year, I just came back from Argentina. I didn't open my computer. Like I made it a point to say that at President's cabinet. Surrounded by my boss's boss. No, I didn't check email. And it felt great. You could too. Now, mind you, I had 300 emails to catch up on, so I don't know if I'll do that again. I might have to carve out some time and do that a little bit better. But yeah, being intentional about what you do and communicating it, that this is what I'm doing, this is why I'm doing it, I'm practicing what I preach. Because yes, it is hard, and without intent to redevelop the circuitry of your default, it just doesn't get changed.
Greg, do you have any insights? Greg, do you have any insights?
Sorry, on mute there. No, I do think that accountability is an important aspect of all of this, and hard data about, in my sphere here, which is certainly somewhat less complicated than the others, is regular surveys of how the technology is meeting the needs of the clinician at the front line, and what do patients think about it? What do clinicians think about it, rather than the perceived wisdom of folks that really aren't taking care of patients, just to be blunt. I think sometimes they have a very good understanding, and you need partners. I think that's the other thing, is in IT and informatics, we had a very a nice situation where the CIO and myself were partners, and so all the technology decisions were really aligned around that mission that Carlton spoke about, and the vision of having a better experience with technology. One of the things that I kind of dream about is, how do you, the things that we've been talking about, how do you take those metrics and get them up into the boardroom? And so I would love to have every single person in our organization know what the adoption of technology is, and the impression and the frontline view of technology, all the way up. And I think that really starts to bring it to the table for conversation.
Thanks, Greg. Corey, you want to say something?
Sure. So your first question was, how do you have a conversation with a leader? And I think the very first thing you need to know is what's important to that leader. Because I think that this is all about the operations and the workforce. But unless you know what's important to them, it's really hard. Last year, again, calling out Dr. Stephanie Simmons and our All In Coalition, we developed, with the help of NIOSH, the Impact Wellbeing Guide, which identifies 6 discrete actions to get this movement begun in an organization. So I'm assuming in the organizational hypothesis or hypothetical you just gave us, this is a place that doesn't know much about it. But what you need to do is to go through and understand what's important to the leader, and then start to bring a roadmap of ideas, build that interdisciplinary team, and start in an operational way that's small enough that demonstrates that proof of concept in a very concrete way, whether that be doing Krasinski's quadruple aim work, repurposing your quality initiatives, or whether that's taking on the AI project. To me, this is about really giving concrete examples and start to build that muscle memory organizationally through those wins. The last thing I would say is, we have tons of exemplars in this room, and so one of our solutions that we've seen, one of our big impacts that you saw me share earlier are, who's got these badges and what organizations are doing this better? I think that health leaders really respond Steph calls it cooperation, right? We've got cooperation happening across healthcare organizations right now. So if you're in Texas, who else in Texas is doing it well? What are those clinicians saying? I think a lot of that it's just that positive psychology, but also just the human nature of what's driving them. And then to your last question about what do we do to sustain ourselves, I think I'm no longer in an academic health system. Ooh, that was great, right, Pam? Well, that did it. Sorry, everybody else. We are hiring at the Lorna Breen Foundation. Anyway, but I do think that is recognizing just what are the things that are going to, from a leadership perspective, show others what it means to live in a more balanced way, and not being shameful about it. We used to, people apologizing for coming back with 300 emails. No, it's I made a conscious choice, if I'm Carlton, to shut this off and balance. As Jen was saying, this is in many ways on me to decide. But so those are just a few ideas. Also, drlornabreen.org. There's some follows on LinkedIn.
Okay, Jen, bring us home. You have the last word here.
Oh, sure. Thank you. I appreciate that. And by the way, I've had to unlearn apologizing in emails, right? Like it is one of those things, right? So a couple thoughts, is, what we're talking about here is approaching problems with a sense of curiosity and collaboration. How often are we approaching problems with I'm going to convince them mindset, right? That doesn't necessarily work, right? Where's the sense of curiosity and really wanting to learn, right? Really wanting to learn, because every problem we have now is part of a solution to something else, right? And if we don't understand what people were originally trying to solve for, we can't solve the current problems that are in front of us. So curiosity and collaboration, right? For some reason, wellness sometimes becomes this like I think it's because it's passionate. People get sort of possessive about these different spaces in wellness. But the more that we can be collaborative and curious, the better off it's going to be. And also, one of the things that I think about sustainability for ourselves is when you hear no, right? How many people have ever heard that before? Right? I like to think of no as not now, not this way, right? And that goes back to the curiosity. Well, how and then when, right? Because there's going to be different no's with different resource limitations, but maybe it just means the how is a little bit of a different way, and maybe the when is a little bit different. And to keep away, when we talk about sustaining ourselves, to keep away from the mindset of they wouldn't let us do that, right? But instead thinking of the how and when we can do that.
That's great. Give this panel a round of applause.
71 years old. I'm old enough to remember, I love basketball, and I'm old enough to remember when I first saw a guy named Dr. J, as those of you know. And to my shock and awe, I saw a man fly. I mean, I'd never seen that before. Nobody had ever seen that before. And it was incredibly inspirational. But there were people that were younger than me in high school and in grade school that saw a man fly, felt the inspiration and the awe, and then they decided, I want to fly too. So if you look at the league now versus when Dr. J first came in, every single player can do what Dr. J did. Every single college player can do what Dr. J did. And of course, in fact, there's this young guy named Cooper Flagg, who is the best college player in the United States, who came from a town of like 500 people up in the state of Maine and can fly like that. So what I want you to do is give this panel another round of applause. As inspirational as they are, I want you to look at them as inspiration that says, if they can do it, we can do it. So give them one more round of applause and say that in your head. Thank you. And I'm going to turn this over to Chantel Brazeau, who is the Chief Wellness Officer at Rutgers, and see if you can beat the Dr. J panel here, Chantel.